Wilson's disease is a gene mutation inherited from both parents that causes the copper absorbed from our food to build up in our body rather than to be excreted properly. The gene mutation for this disease lies in the ATP7B protein transport gene that in a healthy person would bind with copper to be excreted from the body in bile or in urine. Copper from our food is absorbed by our stomach and our small intestines and travels to the liver, where the ATP7B transport gene would bind with copper to have it excreted. In a patient that's been diagnosed with Wilson's disease, the ATP7B gene can no longer properly bind with copper, which causes the copper to build up in the liver, which in turn causes tissue damage. The copper can often flow into the bloodstream and lead to other important organs of the body, such as the brain. Symptoms from Wilson's disease often don't show until after this tissue damage has already occurred. Some of the symptoms include extreme fatigue and abdominal pain, muscle and speech pattern problems, and a very distinct copper ring around the cornea of the patient's eye. Treatment options differ depending on the severity of the tissue damage that is caused by this disease. The number one medication given to patients is called penicillamine. That's the generic name, and it's much easier for me to say, unfortunately. So penicillamine is a binder, and when taken properly, it will bind with copper to help it be excreted from the patient's body. Patients will also need to avoid food that is rich in copper, such as liver, nuts, and even chocolate, to keep their copper levels low to avoid the tissue damage. Some patients with severe tissue damage may need an organ transplant along with the penicillamine as their treatment option. Undiagnosed or untreated patients with Wilson's disease will suffer severe tissue damage, which will cause organ failure, and eventually this will lead to death.